Good evening, behavioral health. You are now live.
Good evening, everyone. Welcome to Behavioral Health Live. I'm your host for the evening, Tanya Cato. I am a member of Mount Pleasant, have been there for quite some time. I'm the chief of family ministries, which includes quite a few ministries at the church. I don't want to go into naming them all, but I am also a member of this team, and I am privileged and honored to be your host for the evening. During this session, if you have any questions, you can post them in the chat, and we will do our very best to answer them this evening. After the session, if you think of something you didn't ask while we were live, you can email the team at askbht@mountpleasant.org. Again, that's ask, B as in behavioral, H as in health, T as in team, at mountpleasant.org. Okay, so we're going to jump right in. April is Suicide Prevention Month. And for this live session, we have one of our members. She hasn't been with us for a while, so it's a privilege and an honor to welcome her back, Nicole Jones. Nicole is a suicide prevention specialist. And so she's going to be with us this evening as we discuss this topic. Nicole, tell us a little bit about yourself and what you do.
So thank you for having me. I'm honored to be here. Mount Pleasant is my church home, and I have been away doing this work, this mission, suicide prevention. And so I'm honored to be here to share some information. I first want to just introduce myself. I'm a social worker for any social workers out there, whoop, whoop. And I just want to say that, I worked in the field of mental health and substance abuse for many years. But in 2006, I lost my own cousin to suicide. And it was something that I became more familiar with in a personal way and an unexpected personal way. But I realized that I knew how to work with people that I didn't know. I understood how to recognize those signs and symptoms in those folks, but it's harder to see it in someone that you care about. You don't ever want to think the worst of someone that you love. And so I learned a valuable lesson, and I try to teach that lesson to the families that I work with, just so they are aware that you have to look closely. And even when you see something, you have to resist that urge to deny it and ask those important questions. So I'm happy to be here. I'm grateful that we're having this conversation because it is important. Mental health is health. And I always say that mental wellness is a priority that we are not putting enough emphasis on.
I agree. And it's very timely that you're with us tonight, and that this is not just a topic for you based on what you have your expertise in or what's your career choice, but that you have personal experience with it. That makes it that much more palatable to us as we go through this very important topic. So let's just jump right in, start with the basics. Let's talk about, suicidal thoughts and suicidal behaviors that we can look for.
Well, I would say there are risk factors that are things that are on board that make us prone to suicidal thoughts. And that can be something like having a history of a suicidal thought or behavior. So it's almost like crossing that threshold. So if you make an attempt, that means that an attempt may be more likely in the future because you've crossed that threshold. Family history could be a risk factor. And the funny part about family history, we don't know if it's because people learn behavior in families, like maybe someone died by suicide or a family member struggled with suicide attempts. People in the family may learn that behavior. But they're looking at whether there's actual genetic connection to suicidality. Like you might have a predisposition for alcoholism. They believe the same thing could be true for the risk for suicide. And you think about families like the Hemingway family who had multiple suicides in their lineage. And even Edgar Allan Poe had family history of suicide. So we don't know if it's nature versus nurture, but it's certainly a risk factor. And then we think about things like chronic pain, substance abuse, and mental health issues. The statistics show that about 80% of people who die by suicide, 80 to 85%, have a diagnosable mental health or substance abuse issue. Whether it's being treated or not is another question, but they have a diagnosable condition. And then what happens is all of these other factors get poured on top, and it just creates a perfect storm for suicide risk. When we're talking about teens, bullying is a big issue. And so those are some of the things that make us prone to suicidal thinking. There's so many others. I really, I can make sure that we connect folks to a real comprehensive list. But also I like to tell people there is no one box.
Okay.
What makes sense for you may not make sense for me. I met a veteran, when working with veterans, I met a veteran that went into the military, and because he had an ankle injury, he had to be discharged medically. And he became suicidal. And we were thinking, oh, we can provide you with vocational resources and we can, connect you to jobs. We didn't know that he was a fourth generation military member.
Oh.
And for him to be actually asked to leave the military was shameful. And he felt like he let his family down. And so there is no one box. So it's good to know what the risk factors are, but what might be enough for one person might not be the same for another. And so we have to look at individual situations. So just any time that stressors are piling on, that's where the risk for suicide can linger.
So are there stages to suicide?
Yeah, I believe there's a continuum. And I know we wanted to focus on families. We're putting a focus on people who've experienced loss for suicide. And I like to talk about it as a continuum because prevention is what we do when we're trying to prevent suicides, right? Intervention is where we're actually trying to help someone who's identified as being at risk. Postvention is a new area of research and interest where they're identifying people who have lost someone to suicide are at more risk after that loss. And so providing some postvention, which is support to people who've lost a loved one to suicide after that loss, can help them build the resistance and resilience that they need so that they don't become someone at risk and ultimately have attempts and maybe die by suicide. And so postvention really looks at how do we promote protective factors and healing after a suicide loss.
That sounds good.
So go back to your question because I want to make sure I addressed every bit of it. What would
it was, are there stages?
Yeah. And so when I talk about the stages, there really are. And initially someone may think about they'd be better off dead, and that might be a thought that they have, but it's more passive. They're not connected to the idea of dying by suicide, but they just said, you know what, I'd be better off if I were just not here. And then that progresses to a thought of more passive, well, if today is the day God takes me home, I'm okay with that. And that's still a real, risky place because they want to die, but they just, they're hoping that it happens to them and that they're not going to do it to themselves. But eventually that progresses and then they start thinking about, ways to actually end their life because the suffering continues. And so, yeah, there are phases and stages, and people reach out in ways when they're struggling. They may joke around about suicide and hope that someone hears that cry. I call it, some people say a cry for attention. I don't think that. I think it's really a cry for help. People want to see, because there's so much stigma out there, they're afraid to just talk to people honestly about how they're feeling. And so they may joke around and just see how someone approaches it. And my recommendation is if someone jokes around about suicide, always pull them to the side or just have a side conversation and say, look, I want to make sure you're okay, because, that's really such a serious topic. And I want to just check in with you because I care about you. But yeah, there are phases. In any phase, you can help someone think better of the idea of suicide and intervene to get them some support.
So one more question before we move on to the next category of questions. How important is it for people who are suicidal to be connected to other people?
Very important. I think for the pandemic really showed us that, and unfortunately, we may see that the numbers of suicides have increased over the next 2 years when we start looking at the data, because during the pandemic, there was a lot of social isolation. And people who were already isolated maybe started working from home. And so now they're home all day, every day by themselves. And so having a network of people that you're connected with that are accountable for you, that just check in and say, I ain't heard from you in a minute. Where you been? What you doing? Is really important. And even when people don't have a lot of family, I always stress it's so important to create a family. And family doesn't have to be blood. It's just people who care about you and that you care about, that you can create this network of support that you may need for whatever reason. But yes, that definitely is a risk factor. And I always make suggestions on how to combat things like that. Get connected to a church family, get connected to a support group, maybe another type of group, like a biking group or a bowling group, something where you can get to know people, but if you're not a people person, it won't be very uncomfortable. You can bond together over common interests, but it is important to have some sense of connectedness.
That's good. I want to stop here and put a plug in for our life groups, because we have just kicked them off in April. So if you have not joined one, this would be a great reason to join one.
Excellent.
So just another question on this topic. You talked about warning signs as it relates to what a person may say. What about what a person may do that could be a warning sign?
Okay, so what I was talking about earlier, those were the risk factors. The warning signs, I'll go over a few. These are the things that you recognize that show that there's immediate risk. So there are risk factors. Those are the things that are on board that make you prone to suicidal thinking. The risk factors are the things that you recognize that mean that person needs some help right away. Okay. And so those things could be someone talking about death, dying, maybe even making plans for their funeral. That would be someone we want to make sure gets connected with someone, because they're thinking about it beyond just a passing thought, beyond just, I wish I were dead, I'd be better off. This is more in the planning stage. Anyone that's asking about access to any lethal means, maybe they want to borrow someone's gun. Maybe they've asked their spouse where the key and the ammunition is. Those kind of things indicate immediate risk. And one of the things I want to talk about when it comes to immediate risk, and this is important because we live in an age where there is a lot of mass shootings, and what I call murder suicides, where people are in a distressed state, they murder others and then take their own life. And so in Maryland, what I don't think a lot of people know, and I'm hoping this will help get that information out. In Maryland, there's a law called it's called an ERPO law. And of course, I don't know the acronym right now. I know it's emergency removal, but it's basically removing weapons from the home if you deem that someone in your home is unsafe and those weapons need to be removed. And it's done through the court system, where you can petition the court, you can document your reasons as a family member, and then the courts make a decision. And the police do come, they do confiscate the weapons, they do hold them under that person's name, but they do require that they have written documentation that they've gained treatment, that they're safe to have these returned. And it is a last resort type of action, but it can save lives.
Yeah.
And so it's good that people of the residents of Maryland are aware, so that if anyone that they're concerned about has a weapon, has access to ammunition, they can intervene if that person is not willing to voluntarily give up those weapons. But those warning signs let us know that they're thinking about death and it may be imminent, and we need to make some kind of intervention. Taking them to see their doctor. If we feel like it's imminent, maybe they've locked themselves in a room and we know all of this information, we may want to call 911. And I'll preface that by saying, also, I want people to recognize that they have mobile crisis teams now. So when you call the police, when you call 911, you can ask that they send a mobile crisis team, which two things will happen. They'll either connect with the mobile crisis team that's in that county, because lots of counties in the state of Maryland have them, or they will send a social worker out with the police. So there is a mental health provider at that intervention. It's unfortunate, but people have died at the hands of police after a call for a mental health crisis. And I just think that we have to be better at meeting the needs of our people.
Yes.
When they're struggling, the last thing they need is a police officer banging on their door and making them feel even worse.
Yeah.
And some often plan to provoke the police in an effort to end their lives. That's called suicide by cop. And so there is a lot of danger there, but we want to train our professionals, police officers, and have mental health providers there so that those interactions can be safe.
Is there a certain age group that's more prone to suicide?
No. And I always tell people that suicide is an equal opportunist.
Okay.
The unfortunate part is it doesn't matter what race you are, it doesn't matter what age you are, it doesn't matter what sex, it doesn't matter what socioeconomic class. As you see, there's celebrities that die by suicide, people that we think their life must be grand. They have money, they have prestige, they have everything that you think you need for happiness. So it really points to depression and mental health issues. They're real. They're not, they're not situational. They're by physiological imbalances that happen in our brain, and chemically we are unable to function. And for some people, it's hard to move forward in that. So I've worked with 90-year-old people who were considering suicide, as well as some as young. I know in the city of Baltimore, there was a documentation of a child as young as 6 who took their own life. So I just want people to know there is no one box, because I remember a time where suicide was not a Black community issue. That, oftentimes Black people would say, oh, we don't die by suicide. That's not a problem that we have. And the unfortunate part is that Black males are the fastest growing population that die by suicide over the last 3 years. Wow. And so we do have to pay attention to it. And Black families do suffer loss to suicide. And so we have to remember that there is no safety when it comes to that, especially in this time where we live in a very broken world. Yeah. And there's nothing but sadness and tragedy.
Which leads us right into where we're going next. And that is, let's talk about hopelessness and how that leads to this unfortunate event.
Yeah. Hopelessness is a real key factor. If someone's, communicating that lack of hope, I just want to give up, I just want to disappear, this seems useless, hopeless, all of those things, you want to pay attention. But what I will say about hope, it's just like suicidal thoughts, hope, it's a temporal thing. Like in the minute you can feel hopeless, and then the next minute you can feel full of hope. The same is true for those suicidal thoughts. One minute you can be struggling, and then the next minute you can feel like you've gotten hope back and you can move forward. That's really the goal, is to provide some hope. One statistic I brought that I pulled up really quickly is, this is in regards to access to lethal means, but it ties into hope very nicely. Research shows that people made a decision within 5 minutes. 24% of those that attempted suicide made that decision in less than 5 minutes, from thought to action. So we know it's partly impulsive, right?
Okay.
Another 24% made that decision from 5 minutes to 20 minutes. So in 20 minutes, 50% of suicide attempts occur. And I'm imagining if we were able to communicate with those that had died by suicide, it might be the same. Just a decision, an impulsive decision to take their life based on some temporal situations. So it ties into hope for this reason, that if we can meet that person where they are, in that depths of their despair, talk to them, be there, give them a little bit of hope, 30 minutes of there is hope for their situation, it can make a huge difference. It can save a life.
Yeah.
And so the reality is, you just have to be compassionate, meet that person where they are, allow them to feel that pain that they're feeling, but help them to know there are other options available. Suicide is an option, but it's not the only option. And then ultimately make sure that their environment is safe. If you're a family that has, excuse me, a loved one that struggles with suicidal thoughts and depression, it probably isn't a good idea to have unlocked guns in the home. It'd be important to really talk about safety in the home. The same is true if there was a loved one who has attempted suicide in the past by taking prescription medication in the medicine cabinet. It might be important to have that medicine, most of it locked up, and then a week's worth in a pill box, because we want to provide the hope, but also limit the access to those things that are very dangerous. And weapons are most important, because most of the time, if someone who has access to a weapon is thinking about suicide, they're not going to shoot themselves in the foot. And that's really the danger of having, guns. It increases the risk for suicide because it's such a lethal method. And that's why professions like police officers have high incidence of suicide, because if they get in a stressful situation, they have a gun right there on their hip. And that impulsivity can be unfortunate, but can lead to death by suicide. So yeah, there are ways that we can infuse hope. But I think we also have to be practical and say we also have to limit access to something that's lethal, like guns. But another thing about hope is, I always encourage folks to create a hope box. Have a box, a shoe box, with all the things that make you happy about life. Your children, your job, if that's what makes you happy, your hobbies, and put all of those things in there. Pictures of people that would miss you, letters, things that are really important. And for some people, I say, okay, if you store your gun in a box and it's loaded, I don't recommend that, but put it inside a hope box, so that before you get to it, you have to go through all these pictures of your family and your loved ones, and these letters of people that care about you, so that you can make a informed decision and give yourself a minute to just take a deep breath and think otherwise. So there are other ways to infuse hope. And so we have to be creative sometimes. And I think that's one that I love, because it really does require people to look at what they have in their lives. Who are the people that would really miss them?
Yeah.
And it's a fallacy. Sometimes they feel like they're relieving their family of a burden. They're dealing with me and my issues. I'm such a burden to them. and they convince themselves they're doing them a favor by taking their lives. Where the fallacy on the other side is the family members say, oh, you're thinking about suicide, that's so selfish. But the reality is we have to meet each other in the middle and have compassion for that moment where really, no matter what the reasons are, someone feels like their life is not worth living. And we know God doesn't make mistakes. Whatever we go through, it's for a purpose to build us up, and that whatever he brings us to, he'll bring us through. So it's just important to remember that.
Yeah. You know, when you were talking about the create a hope box, I have what I call a joy box. And I just so happened to be leafing through it today.
Yes.
Because I'm in the process of moving. And so I've put a lot of most of my belongings in storage. And so I just happened across it as I was looking for a couple of pairs of shoes. And so I just sat down on the floor and just started going through and just pulling things. And I found pictures. I found DVDs that I liked. I have books that I love to read over and over. I have greeting cards. I have letters in there.
Yeah.
I have some test papers from when my children were in grade school. You know, all of those little things little memories.
It reminds you that you are more than the issues that plague you.
Yeah.
It reminds you that you have a legacy.
Yeah.
And I think that that's really important when someone is struggling, because they forget.
Yeah.
They forget that they've made an impact on people's lives, and that they will be missed. And so that's a great way. I love that, calling it a joy box, because that's exactly what it is. You remind yourself that there's joy to be had in this world. You've captured it and you can capture it again. Yes.
So, I mean, I just want you to just reiterate the fact that that's a good thing. You can just grab a shoebox and create it. Yeah. And so, okay. So another question for you, Nicole. Can hope be restored? If so, we've already talked about one way. How do we do that?
I think, I'll share just as a provider what I see when you work with someone, and sometimes just acknowledging them being able to release what they've been holding on to in that first session. We haven't even gotten started, but in that first session, just the acknowledgement that I can openly express that this is how I'm feeling can be helpful. Yeah. So I think hope can be restored just in the mere connecting with someone who says, oh, I see this in you and I'm concerned and let's get help. And every step of the way, hope is restored. And so I think it's just important that people be open to therapy, because I do think therapy is life. We have to focus on mental wellness, and being able to escort someone to that help is important, because that means you've shown them that you care and that you're there for them during this journey.
Okay. So would you say that for a person who feels suicidal, that therapy is one of the best ways to go?
Yeah, I definitely feel like therapy, and I mean, it depends on what they need. They want to get a full assessment to figure out what is going on. There may be a multitude of things that are individually happening to them at the same time that they need, a lot of support for. Maybe they have a housing crisis. They're in the midst of a pending divorce. They have issues on their job. So there may be a multitude of things. And I always say, we don't feed them false hope. We want to be like, hey, realistically, there's a lot going on, but let's work on this one thing, because one thing can be enough for them to hold on to work on another thing, and then another thing. But I will say that therapy is important, but also being open to medication. Okay. If the doctor says, okay, your blood pressure is too high, I'm going to need you to take this blood pressure pill, we don't question it. Right. But when someone says, hey, your mood is, not stable, and we really want to help you get to a better place, we always question why I don't want to take medicine for my mood. Yeah. But I think we have to think of it just like we do our health issues. If you had cancer and they say this will save your life, you take it, you don't ask questions. Not that we shouldn't ask questions. I want to correct that. You should be informed, but we don't resist it as much as we do with mental health. And I think we have to think differently about that. It is part of overall health. And if the doctor recommends it, try it. See how you feel first before you make that decision. Now, it isn't for everybody. Some people have reactions to medicines and side effects and things that just don't work for them. And then there are other things other therapies that they can consider. Acupuncture is an alternative for people who may not want to deal with medication, but want something to impact their, mood. Acupuncture has been known to be helpful.
Okay, so here's another question. How can I help a loved one who may be in crisis? For instance, like what questions should I ask?
The first thing I want to say is don't be afraid to ask the question, are you thinking about suicide?
Okay.
That is really the toughest question I think that people struggle with. And a lot of people still believe the myth that if you ask someone about suicide, you're planting that idea in their head. And I want you to know, if you leave with nothing else, know that that's not true. What happens is that person's been thinking about suicide in their head for many, many months, and they're hoping someone asks. I had a veteran say to me one time, Miss Jones, you noticed something that my family didn't even notice. And I said, Mr. Smith, or whatever the name was, Mr. Smith, I feel like your family probably recognizes they're just afraid to ask you the question. And so don't be afraid to ask the question. And you ask in a way, so, I'm really concerned. I just noticed some things that worry me. Are you thinking about suicide? And so you're just letting them know, hey, I'm in this with you. I see you. And I just want to make sure that you're okay. And so don't be afraid to ask that question. That's the most important thing. But before you do that, make sure you know what resources are available, so that if they are in need of support, you have an idea of how to get that. And in July of last year, the federal government made that so very easy with 988. Anyone can call 988 from any telephone and get the support they need for mental health, which I love because it's equivalent to 911. If we need emergency for physical or medical issues, we dial 911. So the same is true now for 988. And I do hope that it makes people more comfortable with, reaching out for help, because it's just 3 numbers on their phone.
Yeah. So what should the reaction be? Say you ask that tough question. They admit what you've just said, that they've been thinking about it. They already have a plan. They planned it out. Tell me what this reaction should be.
Okay. So let's just say that in 3 stages or three areas. If they are definitely thinking about suicide, but yet have no plan, like they haven't gone as far as just thinking about they'd be better off dead, they still need support, but maybe not the kind of urgent support that someone else may need in that moment. So if that is what they're saying, yes, I thought about it last week and I'm really, nervous about those thoughts, and, I don't want to die, but yet I'm feeling like it's the best thing. That's where you want to get them connected with someone. You can still call 988, but you let them know it's not an emergency. We just need to get connected to resources. There probably are other ways to connect as well. You can Google resources in your area from your county health department. They'll show you what is available. If you have insurance, you can reach out through insurance and get connected. All of those are ways. And that's if someone needs the support, but it's not urgent. Now, what if someone says, yes, I am thinking about suicide, and I thought about going to the garage with a, pipe and from my exhaust and do that. That means that they've actually went further than just thinking about it. They have a plan. And, if they're home alone, that plan could be executed. And so you have to think about, okay, now we really need to get some support. If someone has contemplated a plan and made any steps towards that plan, whether they called a funeral home, whether they, wrote an obituary, whether they gave away their cat to their neighbor, all of those things are steps that they have considered that need to be taken in order for them to take their life. And so it really requires them to get connected with someone ASAP. And I encourage connecting with the mobile crisis in your area. You don't have to call them through 988. You can call them locally. So you can look up your county, and if there's a mobile crisis, what happens is their mental health professionals come to the door. They actually come in your home. They're very compassionate. They're not police officers. And so there's a little more comfort and working with them. There's not an authority kind of, feeling. And they basically do an assessment right there to decide if you need to possibly go to the hospital, or if they can connect you to some programs that they're affiliated with by making your appointment probably the next day if they are not going to take you to a hospital setting because they think you're safe. And they would do that with your family. So it's a real intervention that's set in your home with your family, which is best case scenario. And then that way you're able to provide them support. Now, that's just the beginning of the journey, because it is a journey. But that is helping them see that when it gets urgent, immediate intervention needs to happen, and then follow-up should occur so that they can continue to stabilize.
Okay, so one of the things, another question I want to ask along those lines is, tell me, you didn't say stay calm, but that's inferred. But what is something that once they hear that their family member or the person they're addressing has considered suicide, what's something they should not say or do?
I heard this from, I work with the VA and we work with a general. He and his wife lost a son who was in combat in Iraq, and also one who lost his life to suicide. And she told such a tragic story of how her son called her through his battles with depression. And she said, just hang in there. Everything will be okay. And she said that he later hung himself. And it just was so hard for her to think about it. But I think we have to realize that language is important. And so I never say hang in there anymore, especially when I'm working with someone who's struggling with mental health issues, because it's just, you just never know what can be a trigger. You don't want to say you have no, as parents, because we may provide someone they're in maybe a young adult, and they live at home and they're not working, and we're providing their everything and they don't need for anything. When someone feels suicidal, we may have this entitled, perspective as parents, like, how do you have a reason to be depressed? You're not working, you got everything you need. But the reality is you have to understand that this is not just about what they have. Sometimes it's more about what they feel, and it could be a real deficit in their, hearts. And so that's something that you can't put your finger on it. And as parents and loved ones, we have to respect that someone feels a certain way. It's not for us to decide whether it's valid or invalid. It is what it is. And we have to, if we want to help, we have to meet them where they are and validate their feelings, whether we agree or disagree.
Yeah. I appreciate this conversation, because I have 5 children. Now, my children are all grown, but they are so connected to social media. And I'm very aware of how important social media is to the generation that my children are a part of. And so I'm just very concerned about how much time they spend on it and what they are allowing into their lives. And so I'm just really thankful for these very practical tips that you're giving. And I'm glad that we are, recording this so that anyone who wants to go back and watch this later, the information is there. So now let's transition.
Let me add one more piece about social media, because I want people to understand, especially parents of young girls, that social media, the research has showed that this is increasing anxiety, depression, and suicide risk for young girls, almost triple what it was prior to social media, and in particular through the pandemic. So what we know is that bullying can, I'll tell you, back in my day, I'm not going to share my age, but, in my day, if you got bullied at school from the hours of 9 to 3. When you went home, you were safe, you were comfortable, you were able to have refuge. Well, social media allows those bullies right into your living room. And so, unfortunately, our teens are facing real trauma. And I want to specifically note for our LGBTQAI and trans, all of the above in the, our pride population, that their numbers also are very high for our young adolescents. And so it's important as families as well as churches to really accept and make safe spaces for our young LGBTQAI, trans, all of the, variations of identity, so that they feel safe too, to be who they are in all of the spaces that they occupy, because the rate of suicide is very high, especially with Black, trans, and the whole LGBTQ group. So we just have to be very mindful of those risk factors and do more embracing instead of isolating people and judging, to allow them to be who they are genuinely, so that they can feel some sense of purpose in this world like everyone else. No one should be excluded from feeling like that they are important, they matter, and that they have purpose.
Yeah, Jesus didn't condemn anybody.
No.
And neither should we.
No.
Okay, so let's do another transition. We've talked about the warning signs, we've talked about the risks. Now let's shift the conversation to what happens, or how can one deal with someone who has actually completed suicide. We know this experience is very challenging because it leaves so many unanswered questions. You don't understand why, and there are so many mixed emotions. So let's talk about how to navigate through those feelings.
Yeah. I always talk about death, and death is unique in a sense that, we experience grief from death. Universal bereavement, we have sorrow, we have pain, we feel that yearning for that loved one. But then there's some other types of losses that have unique experiences, and I'll name a few. Unexpected death. When we lose someone unexpectedly, you have that shock, that sense of, this is not my reality. How did this happen? When you experience a death by violence, people often experience trauma and invulnerability, which means they either become super reckless or they become super anxious, because they're like, this world is so unpredictable. I don't know whether, I want to either go hard and not care about my life, or I'm going to be super afraid to live my life. But suicide is so unique. It's a different type of grief, because it connects some type of anger, shame, even responsibility. Sometimes people feel ownership of the suicide loss, their sense of abandonment and rejection. And, in all the work that I've done in suicide prevention, I've been in this field for the last 20 years. And I don't feel, I feel that myself, my family losses to suicide, I feel like, should I have known something? I'm in this field. Why didn't I see something? I didn't know they had guns in the home. All of these different things, we start to take ownership. And so it's very unique loss. But the reality is that we may not know why. We may not ever be able to discover the reasons. And prevention, I always say prevention is possible. I stopped, the slogan is, suicides can be prevented. And I get that. But having lost someone to suicide, I don't say that anymore, because I feel like it's an injustice to the people who've lost someone, because it provides this "you missed something" kind of, tagline. And the reality is that you didn't miss anything. We just didn't know what we knew until it happened. And unfortunately, now we know. And it's important that we pass it on to other people who may not be aware, how they can save their loved ones. And for me, that was what I did with my grief. I made it a mission to really help other people see what I didn't see in my own loved ones. But it is a very unique loss, and it can be difficult, because it does inherently come with risk that now you've taken on, if you're not careful. And I say that if you're not careful, because you have to connect, you have to make sure that you're taking care of yourself, that you're grieving in a healthy way. Therapy is important. Even if you never had therapy before, after the loss of someone to suicide, I think it's a good idea to connect with someone and get those emotions out. And it may be short-term. Therapy isn't something that you may, need for the rest of your life, but there may be times in our life where it can be very helpful. And I definitely think after a loss to suicide is one of those times. There are resources through American Foundation for Suicide Prevention. Their website is American Foundation for Suicide Prevention.org. And they actually have local groups for suicide survivors, suicide loss survivors. That means you lost a loved one to suicide, and you may benefit from having a group of other people who will share in those experiences, because it's a unique experience. And even as a lost survivor, I don't connect as much with those that may have lost a parent or a child, because I had a different type of loss. And so there are different types of loss. Not saying one is greater than the other, but they're definitely different. And so it's important to connect with a group that will help you to explore your own experiences in this unique grief, and make sure that you're taking the best care of yourself. Self-care is a must for everyone.
Yes.
But in particular, if we've had some struggles or if we've lost someone, those are the times that we boost up our self-care. We double time on the things that we do for ourselves, and those moments that we unwind and really just make sure that mentally we're in a good, healthy place. Because it's almost like a snowball effect. One small misstep, when you've had a loss, and then you don't take care of yourself, and then you start feeling like you can't, get yourself together and motivated, and then it starts creating a depression in you, and then it grows and grows and grows until it's a full-on snowman, and you can't control it. And so it's important that from the beginning you start taking care of yourself after losing someone. Anyone, but in particularly to suicide. And then there are some things that are helpful, really finding a way to honor that person. And not just how they died. Let's not focus on how they died. How did they live? Like, what did they accomplish? How did they create space in this world for themselves? Really focus on all of those things. But it does take time, because it's grief. You've lost that person, and you don't have an explanation, and it weighs heavy on you. Let's see, build a support network. Don't be, one of the things I always talk about, and people share with me when they communicate about having lost someone to suicide, is that people always say the wrong thing. And it's so hard, because you want to have grace for people, but you know, you just, people like that whatever the situation is, they will find a way to say the absolute worst thing ever. But, the main thing is to communicate with people. If they lost someone to suicide, they shared that with you, just be genuine. You may be uncomfortable in communicating, what to say, but say that. I don't know what to say, but I'm so sorry to hear that.
Yeah.
I don't know how I can be there for you. I've never had that experience, and I don't even know what to say, but I'm here for you if you need anything.
Yeah. Yeah.
I think that's just the most genuine thing that someone
Yeah.
can say to you.
Yeah, I agree. I know when I lost my sister, it was, if you don't know what to say, then it's best not to. But the people who just said those kinds of things to me helped the most. And in regard to what you were saying about self-care, I wasn't doing the self-care. I was burning the candle at both ends. And I ended up in ER myself because my blood pressure skyrocketed. So I had to learn to really practice self-care more at her loss than before.
It's almost like, when you think about it, it's almost like when we have a immunodeficiency and it makes us vulnerable to a cold.
Yeah.
When you have a loss or you're going through a really stressful time, you've got to double up on that self-care as if it's vitamin C, because it really will put you in a place to have a foundation to deal with what it entails to have that kind of loss, any loss. But again, talking about suicide, it's a specific kind of loss. Someone who's lost someone to suicide might find themselves thinking about suicide.
Yeah.
And it's real important that they recognize, oh my gosh, I can't believe that. I've never felt that before, but it opened a door. And it's okay to, no need to feel shame. That's exactly what happens, but it's important to know what to do.
Yeah. Okay. And so, you're touching on this even now as you're speaking. How can one become more comfortable with talking about this type of loss?
Stigma still exists. It's unfortunate, but stigma still exists. And I learned early in my career because, again, like I said, I lost someone to suicide, but I was new to the field of suicide prevention. And I remember someone who lost a child said to me after I said committed suicide. And she said, please don't say that. She said, my daughter didn't commit a crime. And I felt, I felt in that moment like, oh my God, I never realized how stigmatizing just that word is. We don't say committed, someone didn't commit cancer or didn't, committed is more about a crime and something wrong, and it has a connotation of negativity. And so I say now died by suicide, lost their life as a result of their depression, because I feel like we have to give, really the importance that language has in stigma. And it starts with committed suicide. That's, we have to stop saying that. And I have to be reminded sometimes because it's something that is inherent. We hear it on TV. We, all kinds of things that have been made normalized about suicide. Even I was on a Zoom call and someone was motioning that it was over and they did this. And, that's something else that can be triggering because you're slicing at the neck, So I'm in this field, but I recognize things. I see things and hear things on television. And I just feel like, wow, no wonder we're all vulnerable because we've made so light of the idea of taking our own life. And so it's important that we reverse that and we start really taking responsibility for the language that can be triggering for people who struggle. For those that don't struggle, it goes over their head. They don't think of it. It's not an offensive thing. But for those that struggle, it really sets them apart from everyone else and makes them feel less than
Yeah.
because they're a joked upon population. And we got to stop doing that. We don't do it to cancer patients. We don't do it to
Right.
people who struggle with diabetes. Let's not do that with mental health.
Yeah, that's good information, Nicole, because again, that's something that would not have occurred to me.
Mhm.
But that's not a blunder I want to make, even, unintentionally. So this is just really, really good information.
And I just feel like having the courage to share. I talk about how I came to this position all the time when I do speaking engagements, that I had a personal loss. But I think it's okay for us to talk about openly that someone, I would say someone, not disclosing someone else's business, but, to be able to share our own story and say, hey, I had a time in my life where I really struggled and I thought about suicide, and thank God I was, I was able to overcome that through this, and this. Sharing those personal stories of success is very important, because a lot of people don't talk about having a suicide attempt, but the reality is they're still here.
Yeah.
They're still doing what they're here to do because they survived.
Yeah.
And so it's important that we hear those stories so that those that are struggling will know that there's hope if you can make it past that struggling period.
Yeah. Yeah, well, this has been a great conversation, and surprisingly, our time is getting away from us.
Oh, wow.
But before we start to wrap up, I just want to once again ask you to talk to us about healing, how the person who has suffered the loss from suicide, what they can do, what are some healthy coping mechanisms that they can employ to take them to healing. And even, is it that is that just even talk about what to expect years down the road. Like, for instance, since this is a personal experience for you, would you say that you've come to a place where it no longer bothers you? You don't think about it. It's no longer, a problem. Just kind of talk to us about that aspect.
Yeah, I think that just as any other grief, it's a long process. I mean, I wouldn't say it doesn't affect me. Of course, I'm always going to carry that loss with me. I'm always going to miss those family members. I'm always going to look back and say, could we have done something differently? I mean, I still think that. And so that's okay. I want people to understand that that's okay to question, but but also know that you didn't know what you know now, and that and those that haven't had a suicide experience in your circle, then go out and research. Make sure you have a little wallet card or some information and resources in case you ever need it. You know exactly what risk factors and warning signs to look for now that you have made yourself aware. For those that actually have had the loss, find some way to make the loss, it's kind of like other death. Find some way to make that person's life not be in vain. And of course, their suicide doesn't invalidate their life in no way,
Mm-hmm.
but you can change that tragedy into some kind of change, whether it's a scholarship, whether it's a mental health seminar that you sponsor, or that you go talk to young kids, or you support someone who has a dream to become a therapist. I mean, just find some way to make it make sense to you, and that you're paying homage to that person that you lost. But I would say in general, we should all be mindful of our mental health. And that means eating healthy meals. If you want your body to feel like it's motivated and charged and energized, don't eat junk food all day, every day. Be mindful of your sugar and your caffeine intakes, because it can create those imbalances. Make sure you get 8 hours of sleep. Make sure that you are talking about things that are heavy on your mind. I think sometimes as wives and mothers, we push everything down and we carry the weight of the world, and it's too much. Sometimes we have to unpack all of that stuff, regroup, and only take what we need, you know? And so those are some of the things I think are so important. Journaling is a great way to release some stress and kind of track how you feel and what you're going through. Meditation, mindfulness. There are lots of mindfulness videos on YouTube so that you can spend 5 or 10 minutes just kind of clearing your mind each day of some of the stressors that are on your mind. Exercising is another one. Getting all of that pent up energy out can help you feel relief for the next day, to be able to fight again. So those are some of the things that I think are important. Have one, this is another thing I always say, everyone should have one person that if you are struggling, that you can pick up the phone and without hesitation, you can tell that person exactly what's going on in that moment. Because in those moments that we are the most afraid and the most vulnerable, we have to have someone that we know and trust that can literally and figuratively talk us off a ledge.
Amen.
And so with that said, I just thank you so much for having me. And I'm hoping that this is very helpful to every ear that has listened, and they can share it with another ear that may be in need of it. But I'm just glad that we're getting the information out, because I do think that's the major thing, is that you have to know what to look for, because if you don't know, you can't intervene. Exactly. And now that we know, it can make a difference.
Nicole, I can't tell you that you have really been an inspiration to us this evening. I'm glad you're back, and I'm glad you are available this evening to talk about this, especially since this is not only a personal experience for you, it's also your livelihood. So in conclusion, I just want to make sure that we reiterate the fact that remember how important self-care is, especially when you're grieving, or when you're just stressed, or when you're going through. It is not selfish to take care of you. It's not selfish to put yourself first. It's wisdom. So we just want to always make sure we reiterate the fact of how important self-care is. We also want you to keep in mind that these behavioral health sessions and these resources and these recommendations are not replacement for therapy or treatment. They are tools to assist you with your healing journey, and we encourage you to seek professional help when you need it. And remember, if you have questions when this session ends, you can email the team at askbht@mountpleasant.org. Again, askbht@mountpleasant.org. Mount Pleasant Cares,